Hello, everybody, and welcome to the ALS United Mid Atlantic Goals podcast. I'm Tony Hio with ALS United Mid Atlantic, and if you have listened to our podcast before, you know that we have talked with people with a variety of perspectives when it comes to ALS. We have had this podcast now for a full year, and we have talked with people who are board members, those living with ALS, some staff members here, like our nurses and social workers, some people who have lost someone to ALS, researchers, and even people outside of the a specific ALS community who maybe have worked on issues like Parkinson's or Huntington's disease, because we're united around wanting to fund great research and science and collaborate towards greater resources for people with brain diseases and improve our mission. You can learn more about our work at alsmidatlantic.org and follow us on social media at ALS Mid-Atlantic. Follow us anywhere you can. And today I'm very excited to finally, on this podcast, talk with our Director of Care Services, Steve Spaulding. Steve's been at ALS United Mid-Atlantic for nearly a decade now and has helped to evolve and transform our Care Services department to be, and I know I'm biased, one of the best care services programs of any disease, of any kind of nonprofit in the country. Our connection to patients is not just about a website or a form or a number. It's about those personal one-on-one connections. So when you come to us with this disease, this diagnosis, you know you're talking to experts who care, who are going to treat you as a human being first and foremost, and are there for you and your entire family through events and clinics and more. So Steve's going to talk about some of his background and also about a recent conference where he attended to collaborate with others and show his expertise. So Steve, with that intro, welcome to the podcast.
Well, thank you, Tony, and thank you for the wonderful introduction. I'll accept that on behalf of the team. They certainly do a wonderful job, and I'm happy to see them recognize our entire team for the work that we do. I'll start there with the team. First of all, I'm Steve Spaulding, as Tony said, and I have been working for almost 10 years with our organization. It's an amazing organization, and we do some amazing work. And I've enjoyed being a part of it and creating it, and for the time I've been a part of it, and continuing to do that because we really do some amazing things, which I'll talk about in just a few minutes. I've been in the healthcare field and working in this kind of field for many years beyond that. And in various roles as a clinician, I pretty much came up from the ranks and then developed as a clinician into leadership responsibilities, and ultimately that really served me well because it allows me to be a clinician who leads clinicians. So I think the team feels that I do and understand the work that they do, but I also have responsibilities as the leader of that department, and that's been a nice role for me, and I think it's been great to be a part of all that. So that's a little bit about my background. Talking a little bit about the services you just mentioned, Tony, Care Services is what we call our clinical services. And what that is basically we try to really close all the loops, all the loose ends, and create a true wraparound for our patients where they have support both in clinic and in the community. And so we collaborate with all the clinics in our geography. And in certain clinic relationships, we have very close collaborations. And what we basically do is we try to take the plan of care in those clinics and help that team apply that plan of care in the community. And we provide resources and guidance and support and advocacy and all sorts of levels of care. And I think the clinics in our geography find our assistance for our mutual patients to be enormously beneficial and helpful. And I think the proof of that is that we have folks who find us through their clinics and they find us on their own, often because other people tell them, hey, you got to go talk to the folks at ALS United Mid-Atlantic because of what they did for me or my friend or my family member. So that's high praise, and we take that praise very seriously because with it comes a responsibility to deliver on that promise every single day. And so, we really do our best to deliver on that promise and make that happen for folks. Our main focus is really what we call real people providing real help. And the reason I say that is because we live in a world that is increasingly not real people, and where you really are disconnected, and where you can find yourself being told, well, here's a website, here's a bot, good luck, ask them the question, throw an application online, we'll get back to you remotely and let you know whether it was approved or not. People appreciate and need programs and financial support and all of that, but they also need as much or more actual human guidance and assistance, and somebody who can sit there and speak with them and really hear their story and understand their unique circumstances and then help them in those circumstances. And I can tell you, personally, I take many of those calls, as does the rest of my team. And every time I get the call, more often than not, people say to me, "Oh my God, thank God I reached a human being, first and
Hmm.
foremost. Secondly, I reached a human being that I could actually reach again. That's a wonderful thing. And then thirdly, I've reached a human being that actually knows something and can help me, who is knowledgeable and has knowledge about this disease and the resources that can be brought to it, and also has resources and programs to offer to assist me and my loved one." So those are really, really critical, and I think make a huge difference. And it's a privilege to do that, myself and my team.
So you started here in 2017, I believe, and we're coming up on 2027 next year. That's how numbers work, and and that will mark our 50th year as an organization. I think our direct care work is at the heart of what we do. That's obviously what you see as well. But you had that background before you came here. What impressed you most when you met the team and saw how it was organized from the start when you joined us in 2017?
Well, I think the thing that impressed me most about the team and the organization is the mission focus. Lots of people, for instance, toss around the words team or interdisciplinary approach, or we're patient focused. I mean, just about every healthcare organization will say that. And I don't judge whether that's true or not in other organizations. I'll simply say this about our organization: it's for real. And I saw that immediately, in each of the people that are on our team and that I've worked with, and really in the entire organization. It's the real deal, and that's really very affirming. And I think most of all, when we're out there talking to and working with our families, it's really, we're able to say in truth that, yep, we really are going to do this, and we really are going to try to commit as much as we possibly can to assisting you and your loved one with your quality of life, with impacting, your functioning and maximizing your ability to be independent, and many other aspects.
And at the heart of our work, the center of our work is our ALS treatment centers. So now I believe we are partnered with, in one way or another, 10 recognized ALS United treatment centers that we partner with in our area. 10 centers that are doing great work here in Pennsylvania, New Jersey, and Delaware, serving people with ALS. You don't have to give a rundown of each one, because then if you forget one, people are going to notice. But just a little bit, what does that mean to have those centers, those clinics that people can attend and get the care that they need and see all of those experts at once?
Yeah, I'm glad you asked, because that is really a critical center of what we do. The ALS clinic, the concept is really groundbreaking, and was one of the earliest models to be developed around an interdisciplinary approach to care, which basically means when you go to clinic, you see all the different disciplines that you need to help you. Rather than, hey, you saw your doctor, now we'll schedule another appointment to see this specialist and another appointment to see that specialist. You see everybody at once at that clinic. And that's really groundbreaking and important. There are many clinics in different disease spaces that try their best to establish a true interdisciplinary clinic, but few of them accomplish that for a number of reasons. In the ALS world, we accomplish it most often, and I would say best. And one of the reasons we do that is because of the partnerships that organizations like ours create with the clinics. It makes it possible financially, in terms of staffing, in terms of support, all the things that the clinic needs to deliver on that. We're a big part of making that possible with these clinics. I think they hugely appreciate our partnerships for that reason. In addition to being an extension of the clinic into the community. So there are a lot of reasons why what we do is in harmony with what the clinics in our region do, and we work hand in hand, and that accomplishes something that would be bigger and better for our families, for our patients and their loved ones than anything we could do independently.
And I think not only does it help them collaborate internally and with us for their individual clinics, but as you and I have seen when we go to visit them, they are collaborating with each other more and more on research and on care. We attended the research training to look at the research center at Penn State Health Hershey Medical Center last year. And as I was looking at the research that they were doing there, they were citing the research at the Jefferson Weinberg ALS Center. And you know that those doctors talk to each other. And that not only between those two clinics and those researchers, but then, when we have our Help and Hope event, they'll talk to people from other clinics in the area. Like it's a really good networking for them to learn from each other's expertise.
Yeah, it certainly is, and I think that collaboration continues to increase and improve year on year, and that's very, very encouraging. I think it's definitely the way things are going, and I think that's a really positive development. The silos are turning into more of a river flow of information and sharing that leads to faster and better discoveries in the search for treatments and cures for ALS. So it's all good, and it's all, I think, a positive development and evolution in terms of kind of where the search is for treatments and cures. There's a lot of that happening right here in our geography, which we're a part of, and that's really a privilege to be a part of that. And as you just shared, Tony, that's one of many examples of where we're doing that, and we're helping to support those efforts on the clinical and the research side. So it really is in many ways groundbreaking, and we're a part of that collaboration.
And we're also collaborating beyond our ALS borders, beyond just ALS. I think it would be important for us to talk about our Help and Hope Symposium, which is coming up on Thursday, April 9th in King of Prussia. You can go to our website at alsmidatlantic.org to learn more. And we're very excited about this year's event in particular because in 2025, the Pennsylvania State Legislature and the governor approved $5 million for brain disease research. And we helped to advocate for that funding, worked with legislative leaders in Harrisburg. And now at our Help and Hope event, we are going to include some experts working on Parkinson's disease, Alzheimer's, and maybe some other things as well to talk about things like caregiving, the need for research funding, technology, etc. Steve, we haven't really done this before. You may have had some talks with people before, but what is this greater collaboration with other organizations to bring people together around brain disease research? What does that mean for the future of ALS and ALS United Mid Atlantic?
Well, I'm glad you asked because you're right. It is exciting, and it is really kind of new in many ways. So, just as a brief background, so neurodegenerative diseases, and some of you already mentioned, Tony, like Parkinson's and Alzheimer's dementia, and there's other diseases. falls under that umbrella. And so while they are distinct diseases that require distinct and different kinds of treatment and research, they also have similarities. So those similarities mean that when you're doing research in one area, it could impact opportunities for groundbreaking research and treatments and cures in other areas, and vice versa. So there's a lot to be had in collaboration in terms of making headway in research and treatments and cures among other disease spaces that fall under the umbrella of neurodegenerative diseases like ALS, like Parkinson's, like dementia, etc. So that's really, I think, people in science, hard science and research have recognized this, but I think only recently uh, has that really been kind of actualized in real life the way we're doing it. So you brought up our Help and Hope Symposium. That's really a great example of how that's coming to reality. You know, we have this panel discussion coming up. We're bringing together other disease spaces and the work they're doing, the work we're doing, and having those discussions about where are the areas where we can assist in sort of our mutual mission to serve our respective disease spaces. And that's exciting stuff.
It really is. And as people who've listened to the podcast or whom I've talked to know, my grandfather had ALS, my dad's dad, my grandmother on my mom's side had Parkinson's disease. And I think about both of their stories and how they were similar in some ways, but very different diseases and different lives as well. So I think of things that my grandmother was able to use that aren't ready for ALS yet. They don't necessarily work, but maybe it can kind of give a roadmap for what you can do with technology for ALS, and then certain treatments that have developed for ALS. That man, if my grandmother had that, if she had that kind of work that we have with social workers and nurses and doing multidisciplinary care that she really didn't have, her life could have been a lot better. And so we always do better when we learn from each other.
Yeah, we sure do. And you just reminded me that one example of something that we'll have a presentation on at our Help and Hope symposium coming up is brain computer interface technology. And we have other things that are just as cool as that. But just to focus on that for a minute, that brain computer interface technology is has life-changing possibilities. Imagine if you cannot speak and suddenly you can speak again
Yeah.
using artificial voice technology and just your thinking, the way you and I speak right now. What an extraordinary impact that will make in people's lives. And we're just about there. And we're going to hear a little bit about that at the Help and Hope Conference. The ability to move a cursor on a computer screen just by thinking. These things are not science fiction; they're reality, and that's really extraordinary. And again, life changing for people who don't have the ability to do that, like you and I do. And those things are really amazing, and they're already starting to impact people living with ALS. They're already starting to utilize some of these technologies, and we're also going to see that a panel of folks who are living with ALS and have limited or no kind of normal communication ability who are going to interact and have a panel discussion because of these groundbreaking technologies. And you'll get a chance to see that at the Help and Hope conference. And I think that's going to be pretty cool as well.
Definitely. I think it's amazing. And if you are just listening to your first ALS United Mid Atlantic podcast, you can go back to our archives and the last year and just our recent podcast with Brian and Lisa Rosica to see how Brian uses his assistive technology to communicate and speak while he has ALS. You can listen to our podcast from last year with Andrew Geronimo and Dr. Grogan from Penn State Health Hershey Medical Center to see their work on brain computer interface. And I do have a conversation here with Charles from Synchron, so you can see some of that, and he's going to talk. They're going to talk more at that event. So speaking of events, speaking of collaboration, one reason we're talking today is that you were just at an important event, the International ALS MND conference. Where was that, and what was that like for you?
Well, it was in Toronto, which it's a great city. I've never been there before, but I you don't get to see much of the city because you're busy at the conference. But what little I saw of it was around the holidays, so I got to go down to the Christmas village there in Toronto, and that was a lot of fun with some colleagues. But other than that, we spent the majority of our time, as we should, meeting and collaborating with one another to talk about how we can, push forward our mutual mission to serve those living with ALS and their loved ones. And to give you an idea of how international this is, it's allied health professionals, which are basically all the different disciplines that you see in clinic and that work with you in the community, including my team. And they meet together as part of the International ALS MND conference. There's two. There's research and allied professionals. This is the allied professionals. And we meet and basically talk about models of care and innovation and expertise developed all over the world. So we had folks there from Australia with that wonderful Australian accent talking. We had folks from the Netherlands. We had folks from all over the United States and Canada, of course, because it was in Canada, Mexico, talking about really different culturally unique models that work in different parts of the world. And it was fascinating to hear that, because we tend to sort of live in our own sort of silo of, well, this is the way you do things. And then you find out, well, you know what? There's other ways to do it that are just as effective and are sort of culturally sensitive to particular parts of the world. So it's really interesting to see and hear and take away ideas and innovations from those conferences that, you know, just haven't necessarily come across before.
So, what kind of experiences, what kind of people did you meet that when you got there, like, man, it's really good. I got to be here and hear from so and so. Is there anyone that like stood out that wow, either finally got to see you face to face because I know you're in. I think you're probably in 30 Zoom meetings a day of some kind. So you talk to a lot of people over the computer. But so either people you finally got to meet in person instead of over the computer, or someone who once you saw them, you're like, wow, this is really enlightening to me. This is something I need to bring back to our team about how we can improve our work at ALS United Mid Atlantic.
Sure, yeah. Well, it is a funny thing, right, in our world today that we can quote unquote know somebody sometime for years and never actually physically meet them until you go to a conference like this. So it is a strange experience to do that, but also obviously a blessing that we have the ability to do that nowadays with this technology. But anyway, yes, I met a lot of really great folks, many of whom I've known for quite some time and collaborated with, but never met in person. And some examples of that were literally our own ALS United network. So there were quite a number of representatives from different ALS United member organizations who attended this conference. And obviously, I know my colleagues from their respective care service departments, but we haven't necessarily met in person until that particular day. So, in addition to obviously just being a great thing to meet in person, it also gave us the opportunity to work on and collaborate on things on a different level than we would have otherwise been able to do. So that was really neat. We had a number of we mentioned earlier in this conversation, clinics partnerships. Well, we had a number of clinic partners from our particular geography that were represented there and actually did some really nice presentations. Our friends at the Jefferson ALS Clinic presented on breakthroughs in dietary collaboration and treatment, which is very, very important in ALS, and did a wonderful job with that. And, I enjoyed being a part of that. Our friends at Temple ALS Clinic were there and they did some presentations. And I really enjoyed hearing, some of the work that they're doing and, spending some time talking to them offline a little bit in more detail about some of that. We had our friends just north of us here in the Metro Philadelphia and Greater New York, who did a presentation on mental health innovations and breakthroughs that were fascinating. And that crossed over very nicely with work being done on the other side of the globe in Australia, where they were doing some amazing mental health breakthroughs and innovation, and resulted, for instance, in a conversation where the Australians are sitting down with me and our friends from Greater New York, ALS United, and talking about these mental health innovations and breakthroughs and helping people who are living with ALS and their loved ones.
I think it's really important to highlight our representation at an event like this, the International ALS MND conference, because not only were you there, but as you said, representatives from our clinics were there as well that we partner with. And it really shows that if you are donating to us, if you're involved in an ALS United walk, if you're volunteering or advocating with ALS United Mid Atlantic, you know that it's not just some neighborhood nice thing like a corner store. Like, oh, we have some people, and we have a grant, like, but that we are connected to a wide network of experts. That is not just like a local network, but a global network. And we're able to do that because of the reputation of our clinics, our staff, 50 years of work on this mission. And so it shows how we are a reliable partner when you come to be part of our organization. Because again, you're when you are looking for an organization to support, it's something that is connected to this wider network, and I'm sure that gives you a lot of backing in the work that you do as well.
Yeah, absolutely. Yeah, it's it's something the the scope of supporting somebody who's living with ALS and the loved ones that support them is so big and requires so many moving parts to be successful that you really have to collaborate and work together. Our organization does a lot, and it's amazing what we do, and we're very proud of it, and we continue to have that huge commitment. But we also know that no organization, no matter how great they are or how much they do, can do it all. And so having the ability to collaborate with other organizations, particularly in our geography, to help do that is huge and makes a big difference. Um, the other thing I wanted to mention is, they had a technology section of this conference, which was huge. It was set up with all this sort of technology that you could go and look at hands-on and then talk to the experts who know how to use it. And there were many really fascinating things, but to just give you an example of two that were sort of really cool and interesting, and I thought groundbreaking, is one, 3D printing technology, which most people have heard about nowadays, but applied specifically in a way that the clinic was able to do 3D printing to create personalized assistive technology devices. So instead of, for instance, a handhold device that is roughly the size of your hand, they would create a 3D handhold device that is literally formed to your hand, like personally to your hand, which I thought was amazing because you could have physical therapy, occupational therapy in a clinic, go, okay, we're going to do this device for you. We're actually going to 3D print this device for you and give it to you, which is really pretty amazing. So that was kind of a neat example, and there were many others of sort of the technology aspect of this as well.
I have a 3D printer in my house. We got that was a present for my son, and he's used it a couple times. But the I can see from his work how you could have a person with ALS go to an ALS treatment center, and they could see that there was a broken part on his wheelchair, or that they needed a different kind of rest on her chair for their leg, some little part, and it doesn't take a lot of work or time necessarily. Like, it's very possible that they could either have it be printed while you're at clinic, or they get the requirements and measurements there, and then they just mail it to you or do a home visit. And that, again, you don't have to go to some other specialist. It's something where you could trust that they're gonna like help you out, or even if you have a printer in your house, they could give you the specs in the future and just say, "Hey, here's how you," or it's something that a 12-year-old could do once you get the kind of tools you need and like someone tell you what to do.
Absolutely. Yeah, the sky's the limit on some of this. So, and it was neat to just see all that laid out very nicely in a way. The conference organizers certainly deserve a lot of credit for that, so that you could actually interact with it. It's not the same seeing it somebody just talk about it or even just present it in a video. To be able to have it laid out on a table and interact with it and have people with expertise explain it and even demonstrate it to you is a pretty neat thing.
So one other important kind of collaboration that I want to bring up, because you talked about Australia, and this actually ties into this, is we were recently at the Free Library in Philadelphia to see the amazing art installation from Eric Brunner and his wife Allie, because I think it's important to credit both of them and their 7-year-old son Logan, who I think is a very important part of this project. It's called Flickering Souls Illuminating ALS. It's there until the end of March. And they have these profiles, these pictures of flickering lights of people with ALS from Pennsylvania, New Jersey, and like this area, but also throughout the country, and even international faces from Germany and Australia, as mentioned. So I thought it was just incredible to see how it looks. I'll put some of the links here in the description on our video. But Steve, what was your experience seeing that? And you know Eric, we've seen him many times at a lot of our Phillies events and our annual celebration. I just felt so proud of him and Allie for making this project, this idea, a reality. So I'd love to hear your thoughts about how incredible that was.
Yeah, I'm glad you brought that up, Tony, because it really was an amazing experience. And first of all, Eric and Allie are just good people. They're just wonderful human beings. And I was particularly pleased for Eric, especially who conceived this whole project and is the one living with ALS, and then his wife Allie, because this wasn't something he thought up last week, and then bada bing, bada boom, it happened a week later. This is a 2-year journey, 2 years. So, this took some grit and tenacity and determination and, a lot of, good and bad days to get here, and he did. So it's a dream achieved. And, I think that's really, especially when you're living with ALS or you're the caregiver of somebody living with ALS, being able to do anything beyond just getting through your day is extraordinary. So, this was really, really something for them. The other thing is, you mentioned Australia. Eric mentioned to me during that one of the things he was surprised at was how quickly he got responses from all over the world, all over the country, and all over the world of people like himself living with ALS who wanted to be a part of this art project that he conceived of. And that was really pretty neat. And frankly, he was as surprised as anybody. So, in addition to some very familiar local faces in this art project, there's also some faces from around the world that are part of this art project that are really pretty neat and demonstrate the universality of that and how, all of us in the ALS space are engaged in this shared mission across the entire planet to serve those living with ALS and help them with their quality of life, with their level of independence, their caregivers, those who support them, treatments and cures. The whole mission is shared by thousands and thousands of dedicated, wonderful professionals and individuals and family and loved ones who are all trying to support those that are living with ALS, and in many cases are doing an amazing job of it.
Yeah, it's really neat to be able to watch someone that's not just a quote unquote patient, just someone who is connected with us, but someone that we know personally and we can, feel personally proud of as a friend now with ALS that gets us done. And we talk about collaboration, one of the most important C's that is part of our mission. Eric was able to get this displayed because of another friend of ours with ALS, Julian, who works in Philadelphia. Julian helped set this up, the location, and just shows like to me, so the three C's that really kind of drive our mission these days are compassion, connection, and community. And this shows all three of those. Another way that we are showing compassion and connection and community is through our ALS United walks. The walks show that community. You see hundreds or even thousands of people at any of our 7 walks. They are connected. You see people with ALS or have lost someone to ALS. They can connect with people. And not the compassion about raising funding for our services and also just being there for each other at these events. So, Steve, you've been at least one of every one of those walks, including our new Scranton walk. So you've attended all of them in one way or another. Tell us about why people should join an ALS United walk in 2026.
Yeah, I have. I've been I try to get to just about every walk if I can. So, and I've been to every walk in one way or another. So, these walks are really, first and foremost, a great opportunity to get together as a community. It sounds like, well, how would you have fun when you're getting together to address and support those living with ALS? Well, they do have fun. We do have fun. The people living with ALS enjoy the walk because at the end of the day, they're getting together often with family and friends, their own family and friends, the community, and the broader ALS community in our region. And we're doing it for an important cause. By raising those funds, it makes it possible for us to do what we do. And I think it's really I've talked to a lot of people who've been a part of walks and raised funds for our mission, and they often say that they see and hear about and celebrate at these walks what they're raising money for. So it's instead of just getting something in the mail that says, "Hey, send me money," instead you're being a part of something that you can see and experience and be inspired by and be a part of and say, "I'm giving to that." You know, and that's really, really powerful and meaningful, much more powerful and meaningful than just, "Hey, I just got solicited for something that I don't know, I just read a paragraph about it." It's a whole different kind of experience supporting a mission like that in that way. And that's why I encourage people to do it, because you really come away from that with a whole different inspired view of what it is you're doing and the difference it makes.
It's so important to raise funding because that helps us do our mission. The money raised through the ALS United Walk or through other donations or through grants helps us provide things like home care, invest in our clinics, and invest in other programs. But Steve, before we end today, because you are the Director of Care Services, I have to ask you this important question. If someone is diagnosed with ALS, how much do they have to fundraise before they get support from ALS United Mid Atlantic?
Zero.
$0.
That's $0. Um, I will tell you, Tony, one of the things I get often in talking to people who first encounter our organization is I'll say to them, I just want you to know that we don't bill you or your insurance for our services. And that's huge because many of these people are very cognizant of bills that are stacking up from all sides in the care of their loved one. And so the last thing they need is another bill. And so it's really important to them to know that working with us doesn't add another bill to their docket of expenses. And they'll often say to me, "Well, how do you do what you do if you don't bill me or my insurance company?" And I'll say, "Because of donor support, because of people who come out and go to these walks and donate and support us all year long in large and small ways. And that makes it possible for us to do this." And that's enormously reassuring to people and just allows them to access services right away without concern and get what they need to get. First and foremost, a person that they can talk to who can knowledgeably help them, a real person providing real support and services.
Well, as you've listened today and seen on our YouTube channel, Steve is a real person. Our care services are filled with real people, social workers, nurses, other medical professionals who are working on things like assistive technology, mental health, and more. So when you are coming to ALS United Mid Atlantic as someone who has been diagnosed with ALS, a family member or a friend, or you're here as someone who is donating or joining an ALS United walk, you know that you're supporting real people providing real help, as Steve mentioned. Please visit our website at alsmidatlantic.org to get involved today. I also encourage you to go back to our archives for the past year's worth of podcasts to listen to those other perspectives. Email me at tony@alsmidatlantic.org if you have an idea for someone you'd like to hear from, some of the different perspectives you want to hear on our website, and how you can be part of our mission as a volunteer or an advocate, or if you'd like to donate. Steve, thanks so much, and I'm really excited. I know we have a lot of great ideas about what we're going to do in 2026, and we're going to make it possible because of the team that you've helped assemble to provide that real help for real families.
Looking forward to it, Tony. Thank you.